I would like to call the Finance, Ways and Means Committee to order for March 5th, 2025. Madam Clerk, please open the board for roll call. Members, please log in and record your attendance. Madam Clerk, please take the roll.
Mr. Chairman, you have 17 members present. You have a quorum.
All right, thank you very much. Members, please make sure, everybody's signed in. Are there any personal orders or announcements? Seeing none, today we do have two budget hearings. We're going to begin with the Department of Mental Health and Substance Abuse, and I do see Commissioner Williams there. If you'll please make your way to the front, you and your staff. Members, please refer to the dashboard for all of the presentation documents today. Before we do begin, without objection, we're going to go out of session. Without objection, we are now out of session. And Commissioner Williams and presenters, just want to remind you that we will control your microphone up here. So before if you are recognized to speak, if you'll just give it a second, wait for that red light to come on, then you'll be ready to go. But we will control it up here. And members, just a reminder, once you are recognized, you may go back and forth with the dialogue. And if it runs over or we get kind of a running debate, I'll certainly stop it. But otherwise, once you're recognized, please continue with any questions that you may have. With that said, Commissioner, good morning. Thank you for being here.
Good morning, Chairman Hicks, Vice Chair Gillespie, and distinguished members of the House Finance, Ways and Means Committee. It's such an honor to be with you this morning to present our budget proposal for fiscal year 2026. I'd like to recognize our amazing team at the table with me. To my left, Deputy Commissioner Matt Yancey, Chief of Staff and Deputy Commissioner Heather Gunderson to my right, and then to our other left is our Communications Director, Matthew Perriott, who will control the slides. I'd also like to take a moment to express our gratitude and thanks and recognize the partners, providers, consumers, faith-based, and family and department and hospital staff who are both in the room with us as well as are watching on the internet. Your support, your dedication, and your passion for this work are truly changing lives and saving lives for the people we are called to serve, breaking generational cycles of mental illness, addiction, trauma, and poverty, and making our state the best place to live, work, and recover. We all know that we have one life to live and one chance to make it count for something. This budget focuses on giving Tennesseans across our great state the ability to find and start down paths to recovery and wellness so that their lives and communities within which they live continue to count. When putting this budget together, we took a very focused review of where we have been, where we are, and where we want to go. Reviewing feedback from our Planning and Policy Council needs assessment, as well as from our provider, consumer, faith-based and family constituents, and sister state agencies, as well as feedback that we've gotten from many of you. We determined that this year's request would be targeted to continue to take to scale and shore up those evidence-based, outcomes-supported programs that we fund through public-private partnerships across our state, from Memphis to Murfreesboro to Mountain City, Clarksville to Gatlinburg, and all rural and urban communities in between. Annually, our incredible providers serve upwards of 750,000 Tennesseans. And this is very important information because, as you know, the facts that we see every day across our state are more and more Tennesseans struggling. Research says 1 in 4 that struggle with mental health, anxiety, depression, schizophrenia, suicidal ideation, and addiction. Turning to our cost increases that are in your packet, so graciously included by Governor Lee and his team in their budget proposal for the coming year, you will see our first request is to expand the school-based behavioral health liaison program, Our goal, as stated before, is to have one in each school, just like we're doing with SROs across this state. To that end, our request is focused on the continued efforts to take this to scale. Our request is $1 million. Our second request is $5.1 million to provide funding and contract staffing to increase capacity at the Middle Tennessee Mental Health Institute to address the waiting list. This cut funding is not state funding, but comes from certified public expenditure revenues from TennCare. Our third item is a non-recurring investment in the Tennessee Pathways Behavioral Health Scholarship Program. We're asking for $4.4 million for that. Your first investment in this was $3 million during the 2023 special session. We took that money, we partnered with our friends at TAMHO and TADIS, and the response was huge. We had 800 applicants from Tennesseans across this state that wanted to get their master's, and that happened within 2 months of this going live. We had to shut down the portal. We estimate with this funding, we would be able to serve an additional 250 students with this funding. One thing I want to note is that those students have to sign an agreement that they will work at that local nonprofit or one across the state that we contract with. So it's a win-win. It helps with our workforce and it helps that student move forward. Our fourth item is $1.9 million for a substance use treatment residential rehab rate increase, which would help us to continue to get closer to the TennCare rates. Y'all know that we have been examining our rates that we fund our providers, and we'd like to get closer because they're falling behind, and that's why we're asking for this. Our fifth proposed cost increase is $4 million recurring for the behavioral health safety net. This investment would make recurring the rate adjustments that you approved during the special session in '24, and they were non-recurring, and we know that we need them. We've been spending them, so that also helps us on the mental health side to stay close to the TennCare rates. Our sixth proposal is $1.4 million for our crisis services continuum. This non-recurring funding would cover our immediate funding gaps and address rising department costs potentially linked to fewer TennCare covered members, as well as an increase in the demand for crisis services related to the statewide use of 988. This will help ensure that our crisis services remain the way they are today, 24/7, 365 days a year across all 95 counties. It will also give us time to work with TennCare to do a complete review about the current rates, who's covered, and see what we can do in next year's budget. Next is the fourth round of the state opioid response grant funding at $30.7 million. This is federal funding that allows us to provide treatment and prevention of opioid and stimulant use disorders. You will see that the 8 positions that are listed there are not new positions. They're current positions, and this funding allows the continuation of those individuals. The addiction recovery program, you'll see year 2 of 4, that's $2.1 million. That allows us to fund providers that do wraparound support services when somebody leaves inpatient, detox, or any other kind of treatment where they go back out into the community. Our Community Mental Health Center workforce development. This allows us to provide non-recurring funding for the support of licensed behavioral health professionals who are supervising individuals seeking clinical licensure in a behavioral health profession. Substance use disorder treatment, $2 million, provides non-recurring funding for payments to substance use providers. Again, this is TennCare shared savings in our budget looking at year 2 of 4. You approved the first year last year. Tennessee Sports Gaming Fund, the 4.3 some odd million to provide non-recurring funding from the fund that already exists for grants to develop and establish treatment programs and resources for gambling addiction and compulsive gambling. That also comes from the Tennessee Sports Gaming Fund. K through 12 Mental Health Trust Fund grants, also coming from those dollars that are the K through 12 Mental Health Trust Fund. This will allow us to provide non-recurring funding for community grants to enhance the behavioral health treatment services across the state for kids. Turning to our proposed reductions that are in your packet, you will note an offset of certified public expenditures of about $3.2 million and a reduction in our FERF rent at a total of $323,100. Finally, we'd like to show you a couple of slides highlighting what we've done with your investments in this last year. First, the need for the services we provide. We've already spoken about the prevalence data. You'll see that there are 45,000 Tennesseans living with serious mental illness and are uninsured and have no way to pay for services. On this slide, you'll note that's who you fund us to serve. You'll see our behavioral health safety net served more than 34,000 Tennesseans uninsured last year with the same array of services that TennCare offers, except for the residential piece. And on the substance use disorder side, you'll see that there's an estimated 132,000 Tennesseans in the uninsured indigent place. And we served more than 22,000 of those with our provider treatment and recovery services. Again, why we're asking for the input of more money because we've got such a large gap there. The landmark provider rate increases we received from you all and Governor Lee have been tremendous. We have still much work to do in this area, but let me tell you how your investments are paying off. You'll see that the year-over-year vacancy since you gave us this funding allowed our providers collectively to have a 21% decrease in vacancy rates. That's 14% among the mental health providers and 7% among addiction treatment providers. And last but not least, an update on our school-based behavioral health liaison program. We're up to 390 funded positions across the state with the goal, as I said earlier, of having one in every public school. Across the last 5 years, we've seen a 255% increase in the number of students receiving direct services. That's huge because these mental health, school-based services provide great outcomes, as you can see. Reduced discipline rates, that helps the teacher. Reduced truancy, that helps that child, the family, and the community. Increased academic success, and increased graduation rates. We're so proud of this program and the amazing people who do this work every day. As always, we're so grateful for your support and of the work that we do collectively with our providers in this behavioral health system. In word, in deed, and in dollars, your investments in the mental wellness and recovery of Tennesseans will be a lasting legacy to be felt for generations to come. Thank you, and we look forward to answering your questions.
All right. Thank you very much for your presentation this morning, Commissioner. And let's begin. I have several folks on the list, but I'm going to begin asking a question about Jillian's Law. Of course, for some of our new members, Jillian's Law states that if a physician considers someone not competent to stand trial, they automatically have to be sent to a mental health facility. So with that in mind, we appropriated 2.1 million with the 1.2 of that going to your department. So to date, how many individuals have been sent to state-run inpatient facilities due to this legislation?
Thank you so much for asking about that. I've got Ty Thornton, my Chief of Hospital Operations, who can answer your questions on that. But I will tell you, we were extremely supportive of this law, and we're extremely supportive of how we are implementing it. Which allows us to still do a certificate of need and assess the individual before they are hospitalized to make sure that that's the right setting for them to be in. Ty, can you answer the question?
Sure. So to date, there have been a total of 20 patients that have been sent to the regional mental health institutes under Jillian's Law, with 2 of those patients being discharged.
Okay. So there has been enough beds in the state to run the facilities for these patients that are now, we're finding that is under Jillian's Law.
To date, yes, we've been able to accommodate.
Okay. So if there's, okay. That answers my questions on that then. All right, let's move on. Next on the list is going to be Chairman Hulsey.
Thank you, Mr. Chairman. Thank you for being here this morning, especially at 8 o'clock when I can't see. So I'm glad you're here. Roughly 4.6 million in unspent funds expire this month.
Yes, sir.
Can you tell me, will any of this funding be returned unspent?
I can tell you that what we're asking for is an extension on the funds that we have. I can tell you that our team will report back to you what amount is unspent. And I can tell you that we're doing everything we can within the constraints that we've been dealt related to workforce issues to make sure all dollars are spent. We will get you the final number.
Okay. Thank you. Do you foresee any problems spending the full 64 million in unspent funds?
I'm sorry, the full 64 million in unspent funds. Are you looking at that green sheet? What sheet are you looking at,
That-
sir?
That's the number that I'm showing here, 64 million unspent.
Okay, can you tell me what sheet you're looking at, or are you just looking at a total that somebody?
Just a total.
Okay, a
Yeah.
total that someone did. I can tell you that Deputy Commissioner Yancey, myself, and our director, who's now here with us, Gene Wood, Budget Director, have been working every day with our provider community and our staff to make sure we spend the funds that we've got. I can also promise you that we will report out on what was spent and what was not unspent with an explanation as to why it wasn't.
Okay, thank you.
All right, thank you. Next on the list, Chairman Grills, you're recognized.
Thank you, Mr. Chairman, and thank y'all. Good morning. Chairman Hulsey, maybe you need to sober up a little bit before you show up for work. Maybe that helps you see. I don't think that's a problem. Sorry.
It's apropos for this committee, as you know. This is Department of Mental Health and Substance Abuse
Maybe that-
Services, so.
We may go down that road in here in just a minute. Let me get these questions out of the way, and then we'll deal with that. I serve Dyer, Lake, and Obion counties
Yes,
are
sir.
one of the counties that I represent. And these crisis walk-in stabilization units that you've put, just give us an overview of what those look like and how those have worked and the amount of dollars spent, the amount of patients you've been able to serve. So just give us that real quick.
I so appreciate you asking this question. I'll tell you one thing. I held my original work from Memphis, Tennessee. And when I was working 34 years ago, we had one crisis stabilization unit that had 4 beds. And it was a corner of a room where people would come in and get served. Today, our crisis stabilization units are throughout the state. Our providers provide the following that we did not have 34 years ago. They provide walk-in services 24/7, so that if someone needs help immediately, they can go that day, that time, that night. I personally have taken people in the middle of the night to be seen and get walk-in service help. If when that person is assessed, it's determined that they need something that's a step down from hospitalization, that's what the crisis stabilization unit does. They have beds to help people up to 3 to 5 days and get that person stabilized in the community. That's what they do. In addition to that, we've got a kids crisis stabilization unit in Knoxville, Tennessee. If you talk to the people there, including the East Tennessee Children's Hospital, they will tell you how tremendous that has been. So tremendous that we're opening up one in Memphis where we got a high need, and we're opening up another one here in Nashville where we have a high need. Those units for kids will serve the whole state based on that region. I can't say enough about our crisis stabilization units and what they have brought to this state and to Tennesseans. I can tell you that before they were out there, about 100% of people went inpatient. And if you look at how much it costs to go inpatient and using taxpayer dollars for that, what we're able to do is divert almost 69% from inpatient hospitalization, keep them in the community, get them the services they need to stabilize them. I can tell you that we have the lowest recidivism rate in our hospitalization once a person's seen in a crisis stabilization unit compared to the national average. It is amazing what we've done in this state and what you all have funded, what TennCare has supported to make sure that people get the services they need. I'm going to ask Deputy Commissioner Yancey to answer your questions about number of units, number of beds, number of people served. And I will ask our Budget Director, Jean Wood, to be prepared to speak to the amount of money that's going into the crisis stabilization units. Thank you. Matt.
Yes, ma'am. So, Chairman, when I think about the crisis system, as the Commissioner just outlined, it's all about having a place to call, people to respond, and a place to go. And that's what we have here in the state. We have, crisis lines that are operating 24 hours a day. We have mobile crisis providers in every county in the state that respond to people who need a face-to-face assessment. And as the Commissioner referenced, we have crisis stabilization units now and several that are in the queue to be opened. We received American Rescue Plan funding to help support the creation of new crisis stabilization units. We have one that will be opening in Henry County this month, operated by Carey Counseling. Montgomery County and Clarksville is opening a new crisis stabilization unit, which is really going to benefit that community. Centerstone will be the partner with our department to support that CSU. And then next year in Dyer County, Pathways will be opening a CSU. As far as the numbers served, I believe last fiscal year, there was over 110,000 Tennesseans who called our crisis lines. I think there was maybe close to 70,000 people who received assessments through our mobile crisis teams. And as far as the crisis stabilization units go, last fiscal year, almost 11,000 individuals who received a 23-hour observation in that CSU, and almost 6,500 individuals who were served overnight in the CSU beds to help stabilize their crisis. So, we talked to other states about what they're doing related to crisis services. Many states are coming to us to say, how did Tennessee create the system it has now? It's something for us to be proud of.
Matt, can you tell us how many crisis stabilization units we have and how many beds currently?
So I believe we have 12 at the moment. I think it's around 130 beds. And with these new CSUs that I just referenced, that's going to be additional beds added. They typically have about 15 beds each. And those are specific for CSU care.
So the grant funding that you received 2 or 3 years ago was almost $35 million.
Correct.
Now, October, December, you spent about $9.5 million. How much of that will you be able to get it all spent by the time the grant's expired?
Yes, sir. So as the Commissioner referenced with other grants, I meet with my team weekly, monitoring spend rates, assessing for ways how we can ensure that every dollar is invested to the benefit of folks in our state. As it relates to these ARP funds, I believe we have until the end of December of 2026. And we are working with these providers to ensure that they draw down the funds appropriately. We anticipate the funds will be spent.
And you also had the opportunity for the mobile crisis units, and then you were not approved for those funds to be used for mobile crisis units. Are you familiar with what I'm talking about?
Yes, sir. You're talking about the vans.
Right.
And we weren't approved to be able to purchase.
So what are you doing
and
with
thank
those
you.
dollars that you had allocated for those?
Yes, sir. We're putting those back into services and
Okay.
expanding the services.
Okay. 2 more questions.
Yes, sir.
How many of the patients that you're dealing with, especially younger, maybe under 18, are coming from single parent homes? Do you have any data points for that?
We do not ask that question currently. If you would suggest that we ask that, we could look into that, but no, I can't tell you. I'm sorry.
All right. And then how often have you seen a correlation with mental illness and alcohol abuse?
Often. Often. If you look at research, a couple things I'll tell you. Co-occurring disorders, that's mental illness and substance use. Those can go hand in hand. A lot of times people with a mental health concern, as you all know, if you know people with mental illness, they might self-medicate. because alcohol or some other substance helps them with hearing voices, or it helps them calm down in the initial part of it. But yes, sir, there's a correlation.
Thank you, Chairman. I won't ask you more questions at this time.
All right.
If
Thank
we
you.
have some extra time at the end, I may.
All right. Thank you, Chairman. All right. Let's go next to Chair Lady Moody.
Thank you, Mr. Chairman, and welcome, Commissioner, and to your team. We appreciate you being here today and taking our questions. I'm going to kind of go a segue. I do have someone in the audience that is in Covington, Tennessee. Jimmy Jackson. He's our director of our professional care services in West Tennessee. He does a great job, and members, they have been so good, very gracious to invite me to different things to come out and meet the staff and all. And you know, another component of this is those people's mental health, right? and they have so much good times, and but I know they are very serious and do a great job. So glad you're here. Thank you. But Commissioner, Representative Grills and I did not coordinate this, because my question that I was thinking of was even beyond do you keep any stats on if you know if illegal drugs are part of the cause of the mental illness?
We keep stats on the people that we serve based on what the mental health concern is when they come in. If there's an addiction and what that addiction might be, yeah, we have stats on that.
I'd be interested in seeing that
absolutely.
if you don't mind.
Absolutely. We have our assistant commissioner in the audience,
Okay.
Taryn Sloss, over substance use, as well as Sage West, who's our assistant commissioner of mental health services. We keep really good stats. We have a research office in our department and feel very strongly about data and the ability to give you all in the Tennessee community what we're doing with the money. So yeah, we can get that to you.
Thank you very much. Thank you for being here.
Yes, ma'am. And one thing I'd say, you were talking about the staff across our state and their own mental health. That's why these workforce dollars are so important. Can you imagine working with 25% to 75% of your workforce and dealing with what all they had to do during COVID? We're talking people that worked hours that are unimaginable. We're talking people that are seeing people that are sicker than they've ever seen before. I have gotten so many emails and calls from the providers saying, thank you to you all and to the governor for giving us this funding where we can have people so that we can help people.
Yeah.
And we can reduce burnout. So thank you so much for mentioning that.
Thank you.
All right. Thank you, Chair Lady. Next on the list, Representative Shaw, you're recognized.
Thank you, Mr. Chairman. Thank you, Commissioner, for being here. And I really appreciate your passion when it comes to mental health. I want to talk, of course, you guessed already a little bit about Western mental health. Can you kind of bring us up to date on where we are on with our new kitchen and how many beds we got over there now, and just kind of give us an update, if you will. I pass there every day, but I don't get a chance to stop. So I just kind of like get an update.
I understand. I've got two people that can respond to that much better than me. Deputy Commissioner Gunderson can tell you about where we are with the kitchen, and then Ty can tell you about our beds. Heather?
Yes, Representative. I knew you were going to ask that. We are so excited to be finally working on the phase 2 of Western Mental Health Institute, which is really going to take care of the kitchen and other things. We've been out there meeting to finalize all the design. So that project is well underway. We're meeting out there pretty much every month from Nashville. We have people going out there.
Is that deadline date, by the way, on the
I'll
kitchen?
get back to you on that.
Okay.
I want to make sure I'm 100% accurate on that. So I will get back to you on that if that's okay, sir.
Okay.
So currently, we have a total of 150 beds at Western Mental Health Institute. The Phase 2 expansion that you're referring to will add an additional 25 beds to the bed capacity for Western.
Do we have any deadline date on that project in terms of when it would be complete?
I think that's what Heather's going to follow up with you on.
Okay.
I know that the next meeting with we're doing the planning meetings with the architect, and the next meeting on that scheduled for Friday. So we should be able to get a really good estimate, hopefully this week for you on that.
Thank you so much. And I guess this question might be to you, Commissioner,
Yes, sir.
whomever. If you can answer this, have you had any conversation and with the folks about what might happen or what we'll do with the old administration building there? I know that's a landmark and we love it, but I realize it's really old and outdated, and I just want to know if you had any conversation about what we might be thinking about for that building in the future.
Yes,
And that's
sir.
my last question.
Yes, sir. I really appreciate you asking that. There have been several conversations with local officials. There's been conversations with interested parties, foundation people that have ideas. As you all know, that would be done with Department of General Services and us. At this moment, there's no finalized, this is what's happening. As people look at it, they understand it's going to cost a lot of money to actually bring it up to where it needs to be, but nothing finalized, but there are conversations.
Thank you.
Thank
Thank you,
you.
Mr. Chairman.
All right, thank you. Next on the list, Representative Hicks.
Thank you, Mr. Chairman, and thank you, Commissioner, and thanks for all of your all's hard work. When I got here in 2021, it was pretty grim. It was a hard time for Tennessee. It was a hard time for the nation. I mean, there was more people struggling, I believe, with mental health and substance abuse than ever before in the history. So it's good to know that the governor and your staff and everybody understands that this is not a one size fits all world that we live in. Okay. Currently we have all different kinds of treatment for folks, whatever they're struggling with. There's lots. We want to thank all of the providers across the state that work with you guys so closely. I think that Tennessee is really leading the way right now in mental health and substance abuse. And I know since 2021, we've came a long way. We still have a long way to go, but I truly thank your hard work in the state and just everything that you're doing for the citizens of this state. So thank you very much. Thank you, Mr. Chairman.
Appreciate that, and just would say, we have the best provider network in the country, in my opinion. When you meet the CEOs in your community and see their dedication and their passion to serve the people with the dollars that they're given, and they stretch that as far as it will go. When you see the dedication and passion of our team and the fact that we put 94% of the funds in services, we only have a 6% overhead, that's what talks. So thank you so much for your kind words.
All right, thank you. Next on the list, let's go to Representative Sparks. Representative Sparks, you're recognized.
Thank you, Commissioner. Thank you, Commissioner Yancey, for helping us on the recent town hall at Motlow College. And shout out to Caleb Hemmer, who kind of co-hosted that with me. But I wanted to ask, on average, how long are patients waiting for admission to a state psych hospital after being referred to by mobile crisis for inpatient treatment? I think last year it was reported 48 hours.
Yes, sir. So we're doing better on that because we have more resources in the community to divert people from hospitalization if they don't need it. At this time, I have not looked at the most up-to-date hours that it takes. We can get you an up-to-date time. I don't want to tell you something that's
Yes,
not
ma'am.
true. That's under Ty's shop, and I'll ask Ty if your team will relook at that. We can get that to you,
Yes, ma'am. But we are improving, you would say.
sir.
We are improving.
Oh, we're
Year to
improving
date.
across most of the state. We're having an issue, which is why we're asking for Middle Tennessee an expansion using those CPE funds because we are having longer waits there. Absolutely, we're having longer waits. We're at 100% census here at Middle Tennessee Mental Health Institute. But remember, when y'all passed the law, you allowed us that if we didn't have a bed here, we could have that person be served in Bolivar, or they could be served in Chattanooga. I mean, so we have other options.
Yes. Commissioner and Chairman, if I may, I think I've shared this with this committee, but we have some new lawmakers up here. We hosted a mental health town hall, and I see former Mayor Bill Ketcher in the audience. He was there in attendance, and we had your group there and Monty Burks and
Yeah.
some judges, and the Rutherford Recovery Court was there. Both school superintendents. And I had asked our school superintendent, the late Dr. Linda Gilbert, what was the silver bullet? And some folks have heard me share this because she knew more about education than any lawmaker in this state. Sadly, she passed 2 weeks after she sent me this letter. But here's what she said, Chairman. When I asked about the silver bullet, she says, "Good evening. I apologize for being delayed in responding to you." She said, "Thank you for reaching out." She said, "More funding for counselors would certainly help with the social emotional issues we're seeing." Another area, social workers. She said, "They're vital. Many school districts are not able to fund them." Here's what she goes on to say that's very alarming. She says, "I think it would also be helpful for him and other legislators to talk with school superintendents about the issues we're seeing in very young children. The behaviors of our 6 and 9-year-olds like something we've never seen before. They are inordinately disruptive and aggressive, and while we're bringing all our resources into play, there's no place for these children to go be assessed and treated." She said, "I feel good about what the Department of Education is trying to accomplish, and the emphasis of the whole child." Let me say it again, the whole child, not a fraction of the child, not part of the child, the whole child. And she said, "I'm hopeful that Department of Mental Health Subsidies work alongside them to address the upper tier of children who there seems to be no answers." She died about 2 weeks after she sent me this. And that's alarming for me because we're seeing our TDOC budget increase. We're seeing Department of Children's Services budget increase. And to me, it is just economically unsustainable. I mean, I don't have an economics doctorate like Charlie Baum does, but anybody can see this and see that this is alarming of the money that we spend. And hopefully we get a good return on investment. But what do you say about those 6 and 9-year-olds?
Here's what I'll say to you. Number one, we knew Linda Gilbert. We worked with her, as a matter of fact, in the audience as our Assistant Commissioner of Children and Youth Services, Beth Goodner, who worked with her closely because Beth was the CEO of Trust Point Hospital at that time.
right.
I can tell you that I talked to Linda about the school-based behavioral health liaison program. Her eyes lit up when we talked about being able to try to fund one for every school. What better thing could you do if you've got one SRO for every school? If you have one liaison that understands, recognizes what's going on with kids with anxiety, depression, about to start substance use. I mean, it's incredible, the outcomes. And I've got these liaisons that have come in. They've met with Governor Lee. Anytime y'all want to meet with them, let us know. You will be blown away by what they're doing and the impact that they're having. So what I'd say to that is, yes, sir, we're seeing an increase. But again, prior to her death, she didn't realize we were going to be doing kids CSUs in this state. Can't imagine what she'd think if she knew we were going to be doing those.
Yes,
I
ma'am.
really feel like the way we win this issue is having boots on the ground in the schools and having the ability to respond to crisis and have parents have a way and a place to go when they've got a kid that they don't know what to do when there's a problem. So
Yes,
thank
ma'am.
you for asking
Thank
that.
you, Commissioner.
Thank you. Next on the list, Vice Chairman Gillespie.
What'd I do? Thank you, Mr. Chairman. Commissioner, thank you so much for being here. You know how big of a fan I am of you and your department. With that, switching gears a little bit, I come from Shelby County, as you do as well. And we have a bit of a jail issue back home. And there's a lot of deaths, some intentional, some accidental. With that, there have been a lot of overdoses. And I understand things are going to get in jail regardless, no matter how hard we try. There'll always be stuff that gets in there, bad illicit substances. With that said, in fiscal year 22 and 23, $2 million was appropriated to your department to provide naltrexone. I hope I'm pronouncing that right. For treatment for those participating in drug courts and then also adults in custody in our county jails. For the last couple of years, it looks like about $1.9 million has gone unspent. What's the holdup? Is there an infrastructure problem? Is it a staffing problem? What's going on with those unused funds? Because they are needed.
They are. They are. Two things. I know that I've spoken with you about talking with Lori Powell, the CEO, as well as Case Management Inc., Florence Hervery, and Mental Health Co-op about what's happening at the jail. They are working on a plan because they can provide services today. And I know she's working with the head of the jail in Shelby County and Memphis to do that. As it relates to those dollars, I can't say enough about what our team has done working with the sheriff's offices to get them to want to do this program. Taryn Sloss is in the audience. She's our Assistant Commissioner of Substance Use Services. Taryn, I'm going to ask if you'll come up to the table because I'm going to ask you to respond to something. But just so you know, I took this very personally that we had these dollars and could make a huge difference. And I'd like Taryn to tell you what all we have done to try to get the jail to participate with this. And Taryn, if you wouldn't mind saying maybe what the hesitancies are after you state what we've done. Thank you.
Thank you so much, Taryn Sloss. I'm the Assistant Commissioner with the Division of Substance Abuse Services. And I tell you, Representative, we have been trying now for 3 years to get this program up and going. As you may or may not know, each county and each jail has their own medical staff. They have their own medical staff. So you have to have not only the buy-in from that sheriff and or his team, but also that buy-in from whomever their medical provider is for that jail. So there has to be a collaboration there with those two entities. Also, because we're talking about a prescribed medication, it cannot be given by just anyone. You know, it has to be a nurse or a physician. So we work with our treatment providers to ask them to also collaborate with those jails in order to not only, because you not only want to give someone medication, but they also need those therapy. They need counseling services to go along with that because we need to work on behavioral change. So if you can see, I'm talking about potentially three different entities that need to work together in order to provide those services to those individuals in the jail. That's one thing. But the second thing, those offenders have to want. It's voluntary. They have to want to be on medication-assisted treatment along with clinical treatment. So it's a choice.
Taryn,
It's a
can you say though what we've done related to letter writing, working with,
Yes, so we have not only talked with our treatment providers across the state, but we've also worked with the Sheriff's Association. They have sent out a blast to their listserv, offering, say, hey, this is available to you. My team has had personal meetings, in person, virtual. We will go meet any way that we possibly can to explain to you what the process is. We have, I can't tell you, it's off the top of my head, we have done everything that we know to do, except for, I'm gonna be honest, going to the place and doing it ourselves. So it's a challenge, and it's one that I hope to see that would change within our criminal justice system, because as you just said, those medications are really needed for those people who are justice involved.
Thank you so much for that information. I really appreciate it. I look forward to hearing more about it.
Thank you.
All right, thank you. Members, I have no one else on the list up here. Would anyone like to be recognized? Representative Love, you're recognized.
Thank you, Mr. Chairman, and I thank you for your presentation. Just wanted to ask if you could briefly talk about the success of your faith-based initiatives.
Yeah. Thank you so much for asking about that. In the audience is our director of that program, Jessica Youngbloom. Jess, would you mind coming up to the table, if you don't mind? As you all know, Monty Burks is the young man that we hired to start this. I was so impressed with him and his story and his witness, and he started it, and it's gone gangbusters since then. He's now, in the governor's faith-based office. It then got taken over by Jess Youngbloom, and we have another person that oversees that, Jamie. So Jess, can you please give an update on where we're at and what we're doing with that program?
Yes, thank you so much, everyone, and Representative Love for your question. My name is Jessica Youngbloom, and I serve as the Director of Strategic Initiatives for the Department of Mental Health. And I would say it's going really well. We've seen tremendous growth and interest in the initiative, so much so that we were able to add 3 additional faith-based coordinators to our team. So now we're able to split up the regions by North and South so that they're able to give more attention to the congregations and the faith organizations that are interested in this work. We continue to see an increase in interest in trainings and education that our coordinators are providing, and we are starting to see an uptick in the number of congregations being certified by our program. So I would say it's going very well.
Thank you so much. How might a congregation get involved?
If you can reach out directly to us, or we can reach out to you, and we can make sure our coordinator is in contact with you as soon as possible.
Okay, thank you.
You're very welcome.
Thank you, Chairman.
All right, thank you, Representative Love. Chairman Hawk, you're recognized.
Thank you, Chairman. We're all looking for the red dot there. Commissioner, your team, thank you so much. We've become good friends over the years from working in the same space, and I appreciate the work that you do. And forgive me, I've been in and out of the room this morning, and I apologize if this has been asked and answered already, but tell me a bit about residential services, some long-term residential services, either that we're able to provide through the state, maybe an update on Moccasin Bend, that we're able to provide through the state, but also through our provider care network. Do we have the right number of beds? Do we need more beds? And I know we're talking about the dollars that we're investing have really done some great work, but where are we in terms of long-term residential care, and is that adequate?
Got it. So do you want me to start with Moccasin Bend first?
Please.
Okay, so Moccasin Bend Mental Health Institute, you all have appropriated money for us to build a new Moccasin Bend. As you know, we were looking at the site where it is, did the archaeological survey, found out that that wouldn't be an appropriate site to rebuild it. We're working right now, and Heather Gunderson is our Deputy Commissioner and our Chief of Hospital Operations, TIRE, working with DGS to find a site. We have a location that's being considered that we are hoping to be able to announce in the near future. So that's where we are with that. As it relates to residential long-term services, I want to make sure I'm clear, you're not talking about like our residential licensed treatment. You're talking about like long-term hospitalization. I want to make sure.
Yes, ma'am. The long-term hospitalization.
Yeah, at this moment, how our laws are written, a person is hospitalized as long as they meet commitment criteria. So far, that's been working well in our estimation. So where we are is right now, we do have the beds. We've got an issue in Middle Tennessee, as I said, where we're saying we need to build out. And then if we can get the Moccasin Bend built, I think for what we have today, not knowing what the future holds, that we're good.
Thank you very much. Thank you,
Thank you.
Commissioner. Thank you, Chairman.
Thank you, Chairman Hogg. Next on the list, Representative Chisholm. Yeah, the mic is on. That light doesn't come on, but
Hello? Okay, here we go. So I have a statement, then a question. First of all, thank you all for the work that you all do. I know that it's very, at times, hard work because, you know, whenever you're meeting people at sometimes their lowest moment, it's a delicate balance that you have to have. So, because, you know, in another life, I worked for a organization that was licensed by you all, where I taught a lot of the CPI training and CIT training to many of the officers in Memphis. And the issue I was having, I was losing staff to other, sometimes to even fast food. So I guess my question is, are you all still having the same problem as far as retaining workforce? And if so, what more can we do to help you all with that? Because, you know, again, it's hard work.
Yeah, I can't thank you enough for asking about that. We've got two areas that we focused on with that. One is our providers. You guys gave us a lot of money to pass on to our providers to do provider rate increases. That funding has had a huge impact to be able to get people up to a higher level of salary. And again, we've got Alicia in the audience with TAMHO, as well as I know Mary Linden with TATIS, and we could get you some stats on where that is today. And then with our hospitals, we were able to work with the governor's office where they were looking at how we fared with other places and have been able to truly get higher salaries for those key positions like psych techs that are on the floor doing the work every day. And so, yeah, we're doing really good with that. Our turnover and vacancy rate's gone down in our hospitals.
Again, thank you so much because,
Absolutely.
you know, usually the people who have the most need are usually the hardest to serve. So I want to thank you all and your staff and everybody that works under you all's department for, you know, carrying water for the state. So thank you all so much.
Thank you, sir.
Thank you very much. Representative Sparks, follow up.
Yeah, real quick, I was just going to acknowledge Jolie Shipley back in Rutherford County just sent me a text about a Tennessee Day of Hope celebration
Yeah.
for, I guess with y'all's department.
Yes,
on
sir.
the, I believe it's on the May 10th and, or
It's March 10th.
March 10th. And she'll be joining me this Sunday on our radio program. So
Great.
shout out to Jolie.
Great. Thank you.
All right, thank you. Members, I have no one else on the list. So Commissioner, staff, thank you all very much. Thank you for your presentation. Thank you for answering the questions. Very good information. All right, next we will be having the Department of Human Services, DHS. If you all will make your way forward, please.
Yeah, exactly. I tried to bring your mind.
All right, members, we're going to go ahead and get started. If I can have everyone's attention. All right, we would like to welcome the Department of Human Services. Thank you for being here this morning. And we do want to send our regards to Commissioner Carter. We know he's not able to be here this morning, but I know we are in good hands. So thank you all for being here. And I'm not sure who's going to start. I'm assuming Deputy Commissioner Page, are you
Yes.
going to start? All right, we'll go ahead and let you begin. We will control the microphones up here. So if you'll just wait till that red light comes on, then you may begin to speak. But please be sure to identify yourself and you'll begin with introductions.
All right. Chairman Hicks, thank you so much for having me. I'm Whitney Page. I'm Chief of Staff and Deputy Commissioner for the Department of Human Services. And we do apologize that Commissioner Carter couldn't be here. If you guys could keep him in your thoughts and prayers as he rests and recovers. I am joined by Melissa Cobb, our Deputy Commissioner of Operations, Sherelle Campbell-Street, our Deputy Commissioner for Programs, Chris Ann Hodges, our General Counsel and Deputy Commissioner, as well as Callan Baggett, our Assistant Commissioner for External Affairs. Now, I know I'm not as animated as Commissioner Carter, so if you guys need a second cup of coffee this morning, it will not offend me. I'm just going to go ahead and hop right into our 9 budget asks. Our first budget ask is going to be for 12.9 million state dollars recurring. And this is for ongoing maintenance and investment in department's technology. This is for our mainframe, our cloud cost, things like that. Our next asks are going to all center around childcare. This is one that is very important to Governor Lee. It was addressed in the State of the State. And on a personal note, it's also very important to me because my 3-year-old is in daycare while I come testify for you guys right now. So our first ask is for Smart Steps expansion, and that's going to be $5.9 million recurring state dollars. Smart Steps is a way for us to pay for childcare for low-income individuals, and this expansion is going to take it from what our federal dollars can cover, which is the 85th percentile of income, and it'll take it up to 100th percentile, as long as you are doing things that basically we don't want to punish anyone. So if you're getting married, if you're getting a raise, anything like that, then we can stair step down our Smart Steps expansion now. The next thing that we're asking for is 7.2 million state dollars recurring to expand our wages program. The wages program is a way for the department to supplement childcare workers' incomes. And what this does is takes the income from a $20 per hour cap to a $30 per hour cap. The next is our Child Care Improvement Fund. And I know I'm a fast talker, so if you guys need to interrupt me at any point, feel free, or we can, ask questions at the end. But our next one is the Child Care Improvement Fund, and that is $15 million non-recurring for state dollars. And that was actually from a bill that was passed by you guys, by Chair Lady Moody, Public Chapter 452. And what that does is allows us to use state dollars for things that we can't use federal dollars for childcare, such as capital costs. And our next one is an expansion of our partnership with the Boys and Girls Club. This is one we're very excited for, and it's 10.9 million state dollars non-recurring. And with that money, the Boys and Girls Clubs have said that they can serve 7,500 new and existing low-income youth across the entire state of Tennessee. So we're very excited to expand that partnership. I'm going to move right on into our next ask, which is child support enforcement operations. What we're asking for here is 8.3 million recurring state dollars. And that is because what we've seen with child support is that our revenues and earnings have decreased, but the child support enforcement contracts and wages and things like that with our district attorneys have increased. So this is really just to kind of bridge that gap. It is not an expansion of child support enforcement, but really a bridging of the gap. Our next is our county office rentals, and it's kind of the same issue there. So what we're asking for is 1.5 million recurring state dollars, and that will cover our next 2 years for county office rentals. We've really greatly decreased our footprint when we're talking about county office rentals, but we are required to have a presence in every county in the state. And what this does is bridges that gap between what our federal dollars can pay and what we need to continue paying our leases. Because what we've seen is that lease rates have increased by $4.87 per square foot over the past 6 years. That's just a byproduct of Tennessee being that, a new IT state, is that rents have increased. And so we need that money to help out there. Our next is a relatively small ask. It's for Kids Central. If you guys remember, the Tennessee Commission on Children and Youth used to have this website. It was transferred over the Department of Human Services, and this just helps maintain the Kids Central website, which is really just a resource for any parent that can come and help with child care needs or anything else they need with their children. And last but not least is our assistant district attorney step raises. These are statutorily required, and we're asking for 171,000 recurring state dollars there. And that's just, our statutory step raises. And that, short and sweet, went over all of our budget asks. And unless you guys have any questions directly for me, I will turn it over to our whole team and see what we can answer for you guys. Thank you so much.
All right. Thank you very much. We will begin with, Representative Hawk. Chairman Hawk, you're recognized.
Thank you, Mr. Chairman. And there's very few people that I've known longer than Deputy Commissioner Page down here. So it's been great to see your progress. And please, I know Commissioner Carter is watching. One of my favorite people in the whole world as Commissioner Carter and I have worked closely on the TANF pilot programs and what we're doing there and really making some great strides helping individuals across the state of Tennessee. I'm very impressed with what we've done so far, and to that point, what we're going to do in the future. So thank you. And again, I echo thanks on the Boys and Girls Club, the investment of Boys and Girls Clubs across Tennessee. The investment there is really going to help our youth where they are in the moment, both with emotional and educational and just having that helping hand, that guiding hand. Thank you so much. Let's touch on a more sensitive issue, the SNAP program. We've had some challenges. We're in new computer systems, new uptake systems. I know there may be some legal concerns going on and things you can and cannot say, but tell me a little bit about the technology system, where we have been with the SNAP program, where we are with the enrollees. If you can just unpack that baggage as much as possible, I would really appreciate it. And just to broadly discuss the SNAP program. Thank you, Chairman.
Absolutely. And I'll send this one over to Deputy Campbell Street.
Hello. Good morning, everyone. I am Sherelle Campbell Street. I have the honor and privilege of serving in Tennessee as the Deputy Commissioner for Program and Services. And one of the areas that fall under my office is SNAP and TANF in terms of day-to-day administration. Great question, Representative Hawk. I'm always excited to talk about the great work that our staff is doing, particularly in our new eligibility system. I must admit it has been a labor of love, because you have to remember the old system was in place for 32 years. And I often tell people, if you think back 32 years ago, I had a lot of hair that was very much, was very much into my Aquanet phase. So think about that. And now bridging that all the way up to the 21st century with a whole new system. It has been a tremendous learning curve, but one that the staff has really embraced. We have already seen some really quick wins, going away from a lot of different Excel spreadsheets to one consistent system that is very intuitive. We now do not have as much paper. Of course, the feds, our federal government still mandates paper in a lot of different ways, but we're finding that our customers appreciate some of the electronic pieces of navigating the system. Still very early on, we've been in the system a little over a year, I believe, and we have really seen some great things in terms of realizing some efficiencies in operations, reutilizing staff differently. It has definitely reaped some really quick wins for us.
Thank you. And if I could, just to follow up, our enrollments have declined. Is that because of the new technology system? Are we, again, back to meeting people where they are? If you can tell us a little bit about how we're addressing, hopefully that's a good sign that enrollments have declined, but is there something underlying that we need to be addressing?
Thank you, Representative Hawk. If you noticed, we are getting back to pre-pandemic levels across the safety net system as a whole in terms of enrollment. Anecdotally, there probably are different reasons that I cannot touch, but we saw the pandemic brought about a rush nationally for our safety net systems across many different varying programs. But what we are realizing is the numbers are now starting to equate to pre-pandemic numbers.
It's very helpful. Thank you, team, and thank you, Commissioner, or thank you, Chairman.
Thank you very much. Next on the list, let's go to Chairman Williams. You're recognized, sir.
Thank you, Chairman. Thank you for stepping in today. Just wanted to follow up on two things. Information technology systems, we made an investment around $110 million, 14.8 of that is recurring. Is the goal with this process to marry all the different reporting mechanisms for that and house it in one place? And are we doing that through STS, or is it a separate vendor?
Hi, good morning. I'm Melissa Cobb, Deputy Commissioner of Operations. To answer your question, yes, we are very focused on one DHS. So that all of our customers come in one door. We're able to serve them across programs. What this funding does is increase our ability to do that, but also for data governance, as you mentioned, we have a great source of data coming in through our systems at this point. How are we able to use that to do analytics, but also lean into automation? What can we do to better serve our customers more efficiently and effectively? As Representative Hawk said, where we're at.
Yeah. So there's in this budget, there's an additional revenue. I think it's $20.3 million, and then a portion of that's recurring revenues as well. I guess the question: what will that funding be used for? That's different than what we did last year.
Yes, sir. So half of the funding is, as Deputy Commissioner Page mentioned, is for day-to-day dealing with our cloud cost and also as we transitioned off the mainframe. So that is adding that cost back into our budget to be able to fund the behind the scenes. The other half is to continue that push as technology costs increase every year, year over year. We are trying to maintain to be able to support that and not get behind with our technology as we work. Also, I did not answer your question in regard to STS. We are partnered with STS.
Okay.
We actually have STS with us here today. We collaborate with them day in and day out to ensure that we're meeting any infrastructure requirements, but also to meet our program requirements for service delivery.
A deadline about completion of that. When do you think that will be? Are you on time as far as that's concerned, or are you behind?
Yes, sir. No, we are on time. We are finishing up a few of our programs over the next 12 months, and then it will be ongoing maintenance and enhancements to maintain our system at the technology levels that we need.
Changing gears, was you, Deputy Commissioner Page, talked about the Boys and Girls Club dollars, how important that they are. Of course, Chairman Hawk also communicated on that. Small number, big population. Is there any requirement as far as the drawdown of those funds to ensure that they're going to actually provide services for 7,500 people? Because the reason why I say it's a small number, it's about $1,400 a student for 180 days. It really turns out to be about $8, which sounds super cheap for after school programs. Just want to make sure that if we do invest those dollars, that we're actually touching those number of students. Can you alleviate my concerns about that?
Callan Baggett, Assistant Commissioner for External Affairs. Yes, so if I can back up a little bit, we established a great partnership during the pandemic with the COVID relief dollars that came to the state through FSAG, established a partnership with YMCA's and Boys and Girls Club. And then this is in continuation of that partnership. We have a great process of contracting and getting those deliverables. So the information that we have as of now, and this will be continued in the contracting with the Boys and Girls Club, clubs would receive financial support to serve the current population and future at-risk youth with a cap of $1,250 annually per youth. The allocation will be based on the average daily attendance as reported yearly by the clubs, and 10% would be distributed upon completion of the funding cycle and distributed to clubs who served new kids in a proportionate manner. So we have a great contracting team that Deputy Commissioner Hodges can talk through as well, but we do have a process, and we look forward to reporting back to you all on the deliverables of those.
Thank you for that. I just think it's really important that we're going to distribute these funds that the end user actually gets to the resources in front of them. So kudos to the contracting team to make sure that they are there. And so in the end, in the event that unfortunately we weren't able to reach 7,500 kids, we'd reach 6,500 kids. We would be paying them for those and not for the total amount. Thank you very much.
Thank you. Chairman Grills, you're recognized.
Thank you, Mr. Chairman. And just a couple of off-the-wall questions. The child care that you were mentioning in your presentation, explain how that works and how you qualify and just take it run.
Absolutely. So if you're referring to Smart Steps, so that's our childcare dollars that we use to help low income individuals pay for childcare. So the way that it works is if you make 85% of the state's annual income, then you apply for Smart Steps, and it's on a sliding scale. So if you make $0, we're going to pay for the full amount of your childcare up to a certain amount. But if you make $40,000, then we're going to pay for a smaller amount of that childcare. Each one of the childcare agencies has to be approved through Smart Steps. So the childcare agency must accept the vouchers. And then we pay that directly to the childcare agency.
So if someone does not have a job, they are entitled to more of a benefit. Is that the way I understood that?
Well, if they do not have a job, then they must be in school or so you either have to be working or in school to be able to collect this benefit.
Okay, that was
Yes,
what I was
thank you
getting
for
at.
that clarification
yes,
on
thank
my
you.
end as well.
Yeah, thank you for clarifying it.
Yeah.
All right, Callan.
I just want to add one thing, that the federal grant that we get, the Child Care Development Block Grant, that funds our childcare initiatives in Tennessee, 70% of that, I believe, has to cover the low income subsidy program. That is a requirement from the Fed. So Smart Steps is an incredible tool that we are able to use. And we hope to grab more and more providers to opt in to being certificate providers. It's a great program across the board.
Let's transition to SNAP real quick. Over in my district back in the fall, there was a plethora of calls that were talking about people coming in and just stealing their benefits online. Have you guys seen a uptick in that?
We have seen some skimming, and actually I'm going to toss that over to you. Thank you.
So yes, I'm happy to talk about our process and what's gone on in the past 2 years. We have seen nationwide an epidemic of skimming across the board. This is typically the example that we've heard a lot, is that somebody will go buy their groceries and charge, one time and then go back and get another grocery run and their cart is empty. They'll go and check their balance and check their transactions and see that somebody has used their card in New York immediately after that. That is, unfortunately, it's awful, because these are victims of a crime that is happening too. And so Congress actually in December of 2023, I believe, previously, we were never allowed to reimburse skimmed benefits. Congress then authorized a skimming reimbursement program that Tennessee implemented. And I think these are the most up-to-date numbers, but I will confirm with you. We had $155 million skimmed in Tennessee. We were able to reimburse just over 8 million for individuals. So the way that Congress
You said $155 million.
reported, yes, and I will confirm that that's the most accurate number, because it's still ongoing.
What year was that?
That was while our reimbursement program was in place, which was, I believe, December of 2023 through December of 2024. So it is a nationwide epidemic. It is incredibly heartbreaking, and there are actions that are being taken at multiple levels to try to address. Congress created a skimming reimbursement program for last year that we could replace up to 2 months of SNAP benefits or the amount that was skimmed. And so it had to be verified by our Office of Inspector General and then was sent back out. Those were federal dollars that were reimbursing that skimmed benefit. And then in the most recent continuing resolution, the skimming program was not renewed. So at this point in time, we are taking the data to track skimmed benefits, but we at this time are not able to reimburse individuals.
Where do we compare across the nation as far as the amount of loss percentage wise?
I don't have that information. I'll have to follow back up with you, but I can get you that information and send it to the committee.
Do you feel like that we have a problem here in Tennessee, or is that just something we're seeing all across the nation?
Unfortunately, it's something we're seeing all across the nation. Todd McKinney, our Office of Inspector General, he's not here today, but what we see is that these groups will drive into somewhere randomly one night, pop a skimmer on the machine, then take that off the next day. And just in that 24 hours of a transaction, they're able to steal thousands of dollars and send it to another location to withdraw those dollars. And so then they leave the state. So it's really hard to track, but we're working with the feds and the marshal's office to do that.
So there's a concentrated effort to make sure that this right here sees an end, or there's a fix to it.
Yes. And additionally, I want to talk through what we're doing just at the state level to try to help our customers. I think that with our new EBT card vendor, we have options like things like turning on and off your card when you're not using it through an app, tracking your transactions, changing your PIN number constantly. And then ongoing conversations are happening with the feds about usage of things like chip cards and what that looks like. So we're working with the vendor, Food and Nutrition Services, and our Office of Inspector General in our program area to try to address.
Okay. Now, how do you prevent fraud from people fraudulently applying for benefits and taking advantage of benefits?
I mean, there's a strict eligibility requirement and application process. I'm happy for our Deputy Commissioner Campbell Street to take that question and walk through the application process.
I don't want to make it too hard on you, but you get it real quick.
Yes, sir. Yes. Sherelle Campbell Street, Deputy. Thank you, sir. Such a great color. Thank you. So, as with a lot of federal programs, believe it or not, there's a lot of paperwork. And when you are applying for SNAP benefits, you do have to provide identification for every person that's going to be in the household to provide that will be benefiting from SNAP services. So one thing that we do, actually in our system as well, there are verification models in our system that will allow for us to be able to verify the identity as much as we can of the people that are applying. But you have to these are just examples: birth certificate, rent receipts. What else, Chris, and I might be forgetting right quick. ID, driver's license at time, some kind of ID. So we follow the federal regulations as it pertains to that. And we also embedded in the Office of Inspector General have a fraud unit. And so anyone can call our number if they are thinking that someone may be fraudulently using their card, and an investigation will be opened. And I'll ask our Office of General Counsel, anything that I may have messed up, she can clean up.
No, just sort of embedded in the program, that Chrisanne Hodges, General Counsel, embedded in the program are certain checks and balances, both just through the application process and the steps that the employees must take to make sure that we're properly approving an application through a quality assistance and quality control program where we go back and audit, if you will, through the Inspector General's office, which has a much more robust sort of auditing process. Those things are just embedded in the process anyway.
So do you have an outside vendor that maybe helps with this process, or is this all internal?
This is all internal.
This is all internal. And there is, Representative, a recertification process. So it's not one and done. You have to recertify and have to present that information all over again to some extent.
I'll stop there. Thank you, Chairman. Thank you.
All right, thank you. Next on the list, Representative Shaw.
Thank you, and good morning, Commissioner Carter. I know you're out there somewhere listening. Best regards. Let me just reiterate just for a moment what you just said. So if, in terms of the SNAP program, that if someone get caught up in that fraud, they can recertify. What is the time limit? Because I know that's a critical thing for that person. So what's the time limit in getting recertified? You go in to buy your groceries on Friday, whatever, and you find out there's been fraud. What's the time limit of getting back in the program in terms of recertifying?
So just to make sure, Representative Shaw, I understand, you're speaking that if someone's benefits have been stolen and they report it, what is the turnaround time?
Yes, ma'am.
Mrs. Baggett, I think it depends, correct?
It does depend on the report. I think our state plan allows for 6 weeks. I'll have to follow back up with you on that, what that state plan was. But remember, if they're skimmed now, we currently are not able to reimburse. We are actually just tracking it for data and law enforcement purposes.
Well, I guess this is probably not a question I should ask you, but what do they do during that period of time?
Yes. Good question and a fair question, Representative Shaw. One of the things that we very much try to do is partner. We have offices in all 95 counties, and we are very fortunate and blessed to have partners in all 95 counties, such as food banks, churches, other organizations. One of the things that we try to do on any of those calls is provide resources in the meantime for our customers. That is so valuable to us. And then also, we also thank you, Representative Hawk, who's just left. That's not him. Look, hello. But through our TANF Opportunity Act,
Very
some of
poor
our
comparison.
there is a semblance. Some of our TANF Opportunity Act partners have also stepped up to also provide linkages to food and services during that time.
Let me change gears. This is something that I noticed in your grant programs, Rest Stop Ministries. Can y'all talk about that? What are those and how does it work? And I don't know who would talk about that, but I'm looking at your program and it says that back in 2024-25, it was $50,000 for Rest Stop Ministries. Can you all talk about that?
So there we go. I'm not sure that any of us, as I look around, can speak to this. I have a feeling that's that's probably one of our community grants. So
I think it is.
yes. So our community grants, if you guys remember back to our days where I came before you and talked about TANF nonstop, one of the things that came out of that was that any of the money that we do not spend out of our yearly award now goes into community grants. And so we open those up for application for anyone across the state. And I believe the Rest Stop Ministries was one of the ones that applied and was awarded one of those grants. I'll have to get back to you on what exactly they do. I don't know off the top of my head, but I'm happy to follow back up.
Okay. Last question on child support. And I'm trying to figure out how to frame this to make it make sense. But in the pipeline, I had a personal experience with a young man with child support. And I don't know what was wrong, but what is the pipeline between what you all do and dealing with the people out there in the field when it comes to dealing with those child support issues? Because what it seems like that there was some kind of connection with one of you all's field workers and the person maybe in the judge's office. Is there some kind of check and balance that you all have in your program that you can identify those issues, or it's just that's something that just happened occasionally, if that's a fair question? And maybe it's not fair, and if it's not, I don't mean to put you on the spot, but I'm just trying to find out, because there was such an issue and he had such an issue for such a long time, and finally he got a second judge who gave him the right to see his child, but the first judge wouldn't, and it had to do with the caseworker. Can y'all talk about that a little bit?
Absolutely. So I'll hit on that a little bit. So the DHS side for child support is the enforcement side. So we do not come up with the child support orders. All we do is enforce them. And so the enforcement side has a mix of private and public. So DHS does some of the enforcement, but we also contract with both private vendors and our district attorneys for that child support enforcement. Sometimes it is something that we are able to look into, and any of our customers we are more than happy to look into anything. Anyone can email us at any time, and we are able to talk to our partners. But if it is something from the court order, then again, we're on the enforcement side, not on the order side, and there's not much we can do there.
Okay. Thank you, Mr. Chairman. Thank you.
Thank you. Next on the list, we have Chairlady Moody.
Thank you, and thank you all for filling in where you're needed at any time. It's notice, right? Thank you. My questions kind of want to go to the daycare, child care with that 3-year pilot project. So that was, you dispersed the grants. So to nonprofit organizations, so that one. So can you tell me how much of the $30 million for the first 2 years funding has been spent?
Yes, ma'am. Thank you for the question and thank you for passing that bill. So the first year, as you remember, the original legislation allowed for nonprofit agencies for both capital expenses and salaries. In the first year, we expended fully the full 15 million because we focus on salary adjustments and bonuses. We were coming out of the pandemic assistance money world and continued a process called from the stabilization grants to childcare providers. And so we were able to fully utilize those dollars in the first year. In the second year, I believe, and I'm looking at Melissa, I think we used 11.4 million. We partnered with 3 nonprofit childcare agencies to do an employer-sponsored childcare. I can get you that finalized list. I know one was a YMCA, one was a ORNL, and one was another one that I'm gonna have to follow up with you on. Really great opportunities. I think one thing that we as a department are really moving forward in is looking at how employers really need childcare, but they may need a different version in each of their communities. And so we want to work with the families, the providers, and the employers to fit what they need because one size does not fit all in childcare. So additionally, the General Assembly last year directed us to use some of those nonprofit childcare dollars to do a direct appropriation to a Boys and Girls Club to help finish out a facility. And so we used that as well. And I think that's all, but I will follow up with you if not. And then this year, you all have actually already passed the bill to do this. So thank you. It passed unanimously. But there was the Child Care Improvement Fund fix is what we called it because nonprofit agencies are great and wonderful, but we were also getting asks from for-profit childcare agencies for help with those capital expenses. And so House Bill 105, you all passed last Monday night, and it's moving in the Senate this week. So thank you.
Very good. And then you did say some of the funding went to Boys and Girls Club.
Yes, ma'am.
Let's see. I was trying to read my writing. Can you share with us any early outcomes you've seen from the program?
I think one thing, I don't have any firm outcomes that aren't my Callan's layman terms, but layman's terms, we've got 3 new childcare facilities from that meet the employer's needs in the community, in the state. And I think that's a huge, huge accomplishment because our goal is to expand access and to make it affordable. And the grant process that y'all passed helps us do that.
All right. And do you know off the top of your head how many childcare slots have been created?
I believe, oh man, you're really hitting me with the numbers. I know that, so we established the pre-licensure unit in August of 2021. This is a group that works directly with providers. This is 16 staff members and they are top notch. And so I will tell you that since the creation of the pre-licensure unit, we've created over 21,000 slots, and we've grown from 35 counties with a childcare in them to 51 counties in a childcare with them, and we want to get to 95.
Great.
I'll follow up with you if there's more current numbers, though.
Yeah.
So.
But that's interesting to see it carry on.
Yeah.
So thank you for your answers and being here.
All right. Thank you very much. Next on the list is Representative Parkinson. You're recognized.
Thank you, Mr. Chair. I know they were waiting excitedly for me to get on the mic and talk to them. Now, honestly, I want to say to the team, I think the world of y'all. You know, we have very frank and uncut conversations about some of the things that are going on, and I actually appreciate that. You know, I prefer the uncut versions versus the political versions, and Callan, she definitely gives me the uncut version, and I give it to her too, though. But I do want to also just touch on the child support thing too. I think a little bit more clarification may be needed for my rural colleague over there from Hardeman, and I forgot what counties he's from. I don't want to call his name, but he's from some of those counties over there, Bolivar, right? And you know, there's you know, in some of our counties, we have organizations that do the child support for us, like in Shelby County tied to juvenile court. But in the rural communities, Representative Love, in the rural communities, Representative Love, in the rural communities, but you're distracting Representative Shaw. In the rural communities, Representative Shaw, the rural DAs handle child support handle child support in communities like yours. And so I think there's a difference there's a difference in the way both are handled. But I did want to ask this to the team at DHS, the theft of and going back to that, the theft of the SNAP benefits. Is it coming from an individual locally skimming? Because the way I understood it, based on, because some of these individuals that are receiving SNAP benefits, the money is gone from the card. I mean, all of their money is gone from the card in some cases before they even get the card, right? And in some cases, when the money is supposed to be loaded onto the card, it's at absolute zero, when, they get ready to utilize the card. And so has there been any movement? I saw where there were some arrests in, I think, Virginia or Pennsylvania somewhere, but obviously this is bigger than just one or, a small group of people doing it. Has there been any movement at the federal level to look at possibly their vendors who may have access to this information, at that level?
Yes. Yes. Hello. Thank you for the question. Great question. It is, and to be clear, it is just not a Tennessee problem.
Right.
We recognize that it is unfortunate in every state that this happens. Just to be clear on how we believe that the majority of this is working is a lot of our customers don't have the larger scale grocery stores in which to shop. They go to mom and pop shops, or they may go to the smaller areas that may not have the most up-to-date technology by way of machines. And remember, the EBT card does not have, like our cards, a chip on it. And of course, the chip is designed to help mitigate anybody stealing. Of course, it's not 100%, nothing is, but that does help. And with that not being there, anyone can go and manipulate a machine. It doesn't take much, from what I understand. Don't want to get into that too much. And within seconds, the benefits can be gone. And remember, our wonderful state touches so many different states. It is easy to come and to steal from various different modes and of ways to do that. And to answer the second part of that question, yes, the government has recently recognized, and we were very thankful that they did allow for a period of us to be able to reimburse our customers. Remember also, TANF is loaded on this. TANF never had a reimbursement piece. This is only SNAP. TANF did not. We're hoping that will change as well. But nevertheless, one of the things that we have been encouraged to do, and we have recently done working with Deputy Cobbs on the end there, is look at technological ways in which we can assist our customers in being safe, looking at even Apple Pay for some who have that available. But yes, they have recognized it, and I do believe that we are turning a corner into looking at different ways in which technology can be leveraged to mitigate fraud, waste, and abuse in this area. It is a slow moving process, but I am encouraged by our recent USDA secretary. She kind of listed out some of her visions for the Department of Agriculture, and one of them was improving technology systems, which we believe currently we are doing, but looking forward to our federal partners assisting in that.
Thank you for that. The proposed or the ideas that are being floated around for the reduction of SNAP benefits. What are you? I see the look on your face, Calvin. What are you hearing from the federal level in regards to what's being proposed for reducing SNAP benefits to clients?
Currently, we are not hearing anything representative other than what you probably already know. We have not received any official guidance other than what has been already announced. We stand ready to work with anyone who wants to assist us in providing this much needed benefit to our citizens, but we have not received any official guidance on what a reduction or any change in eligibility would look like.
Okay, last question. You mentioned that the reimbursements of the stolen SNAP benefits was, I think our total was what, 155 million? Is that what it was?
Yes, sir. 155 million.
And is that in the aggregate, or is that in 1 year, in the last year, or is that during the reimbursement period?
That is during the reimbursement period. And so we are still continuing to track what is coming in as a report of a skimmed benefit. But that is from December of 2023, maybe September of 2023. I'll have to remind myself of the start date, through December of 2024.
Do we have a number for the total amount that's been in like the last 5 years that's been stolen?
I don't, but I'll be happy to follow up with you on that.
Okay, do we have and just two more questions. Do we have an average per year that has been stolen, or do we have an idea? So 155 million in this 1 year, right?
Yes, sir. And when the skimming reimbursement program was in place. So I can see what we've had before that, because we still collected that data, because people would call and say, my benefits have been skimmed and stolen. What do I need to do? So our OIG would take that information and in some cases pass it on to law enforcement or things like that. So I'll see what our OIG has, and then report that back to the committee.
And here's where I'm going with that. This is an important point, because to the members, if you look at 155 million in the first year, in this 1 year when the reimbursements were happening, we were talking about this for 2 years at least before they decided to reimburse, right? And so we don't know what that number is, but I think it's important for us to know what that number is and know what the number is now and going forward, because if you think about it, just in between either September 23 and 12/24, that's $155 million out of the economy. 155 million taken out of the economy, possibly by people who have stolen these benefits. But here's my last question. Why if we had 155 million, why were we only able to reimburse 8 million? That's a very, very low number.
So the way that the skimming plan was written, and Sherelle, I'm sorry if I'm stealing your thunder, but we were only the federal legislation that authorized this program was you could reimburse at most up to 2 months of a benefit, or the amount stolen, whichever is the lesser of the two. And then also that you still had to be on SNAP when you reported that your benefits were skimmed. So if for some reason your benefits were skimmed in February and you're reporting in March, but you've had a great life experience and you're off of our rolls, you would no longer be eligible for reimbursement based off of the federal guidelines. So there were some eligibility requirements to be able to receive a reimbursement of skimmed benefits, which is why the amounts are not the same.
Okay. Your response actually gave me another question, but I'll hold it till afterwards, because I want to know where the tie is between people, because this is also in that same space where people were having trouble communicating to get their benefits renewed at the same time. So we'll talk about that offline though. I appreciate you. Thank you, Mr. Chair.
All right. Thank you. All right, next on the list, Representative Hicks, you're recognized.
Thank you, Mr. Chairman. Thank y'all for being here. We miss Commissioner Carter, but you all are doing an absolute great job, so thank you for that. This is going back to child care, okay? It looks like there was $19.4 million allocated to DHS to grow child care capacity through partnerships with YMCA and the Boys and Girls Club. As of the end of 2024, only 6% of these dollars has been expended. The department expects approximately 9,500 child care slots to be created over 61 new child care centers available to families across Tennessee. The proposed budget includes $10.9 million non-recurring grants to Boys and Girls Club to further assist childcare programming. Our questions just give us sort of talk about maybe those funds. Will you be able to get all the funds out the door by the deadline? Because there is a deadline on it. And to date, how many childcare slots have been created?
Well, I believe that the 19 million that you first referenced was part of the American Rescue Plan dollars that came in through COVID. That's our partnership that I briefly mentioned earlier with the Boys and Girls Club and the YMCA's. And Deputy Commissioner Campbell Street, do you want to take that and explain what those partnerships are, or do you want to?
Well, I can. So with those partnerships, you're absolutely right, Representative Hicks. It is to expand the slots and also to engage families differently because childcare involves just not the child, but the family. We anticipate with this particular project to have to touch areas that we don't currently touch by expanding those childcare desert area, particularly with the pre-licensure area and working with the YMCA and the Boys and Girls Club. They are actually going in and partnering not only with these two entities, but the local businesses to see how we can generate partnerships to create slots for the businesses. That has been tremendously something that has been really successful. To date, with the pre-licensure unit, they have created roughly about 20,000 slots. And so working in partnership with these two wonderful organizations, and they really do show up to work out and do whatever they can on behalf of the families, not just the child. We believe that the inclusion of working in these areas with the businesses as well will produce even more positive results.
And if I can just add, the two specific there was two funds of money that were used to help these projects. There was an operational piece of the contracts that were done that were help running these partnerships. There was also a capital piece of that project to either add on or build new facilities. So we do expect those dollars to be spent by the federal deadline, and we have a very constant stream of invoices coming our way right now. So we expect that we'll spend that.
So is that sort of how the 10.9 million non-recurring to the Boys and Girls Club, is that how that'll be utilized?
It's almost a and I am oversimplifying, and so I'm sure I will be corrected after this hearing, but it is almost a continuation of some of that operational side of the contract piece with the Boys and Girls Club. But if I'm wrong, I will hope somebody will come tell me I'm wrong, and then I will follow up with you.
Thank you for those answers. Thank you, Mr. Chairman.
All right. Thank you very much. Next on the list is Representative Reeves. You're recognized, sir.
There we go. Hey, thank you guys for coming out today. I really appreciate it. I'm looking at the proposed cost increases around expanding wages childcare program. You've got 7.2 million recurring for that program, which, as I understand, supplements the salaries of early childhood educators to improve things like retention rates. Can you talk a little bit about that, and what's the current budget for that program?
The budget question I would throw to Melissa. I can get to the program.
I do not have that with me, but we will follow it.
Okay, and so if you don't have that, you may not have the answer to this question, but do you happen to know how much that wages program increases the median hourly wage of those early childhood educators?
So the way that the wages program actually works, it's an annual salary supplement rather than affecting the hourly wage of a worker. It gives them like a $600 one-time a year payment for if they are pursuing their education as well at a accredited institution. So it's not going to necessarily affect the wage, but it is going to affect the annual supplement that they receive.
Okay, and if you don't have the numbers for that, maybe you can talk a little bit about the program. Is there a wait list? How many applications are received and how many supplements are awarded?
So I will be happy to talk about the program, and I'll follow up with you on the firm details of that number. But the way that the program works is that childcare professionals who are pursuing education while they are teaching and going, even if it's at a community college or a 4-year or a master's level, we will reward them with an annual salary supplement to continue that pipeline of teachers that we want in this state. Pre-pandemic, we saw the turnover rate for childcare workers be between somewhere around 42%. And that's a hard, I mean, y'all know, y'all are businessmen, you know
Pretty
this. But with wages participants right now, our turnover rate is 16%. So it is a marked difference. And that's, I think, one thing that we're really appreciative of the governor and you all considering this proposal, because this is a program that works. It's proven that it works. We have data around it, which I'll follow up with you on, to show that we're investing in things that have a proven deliverable and that they've met their measure on that.
And do you happen to know what the turnover rate was pre-pandemic?
I want to say 42%, 32%. I'm sorry, I added 10% to that.
Okay.
So.
Thank you very much.
All right, thank you. Next on the list is Representative Sparks.
Thank you, Chairman. I want to thank this committee and Chairman Hicks, Chairman Williams, and others for funding some of these requests. I mean, really, y'all are kind of doing God's work. You ever thought about that? You know, you really have. I mean, just look at here. You got food banks, you've got Rest Stop Ministries, you've got Anti-Trafficking Coalition, you've got Thistle Farms and Slavery, Tim Tebow Foundation, Blue Monarch Residential Recovery, All Pro Dad. You're hitting on a lot of issues and that need addressing. I mean, the Boys and Girls Club, water safety training at the YMCA. So you're leveraging the private public partnerships, and I appreciate that. You're doing God's work, but I think this waste and fraud and Parkinson's concerns led me into what I was going to talk about: Department of Government Efficiencies, DOGE, that you've heard about. You know, to waste $150 million, not to say you're wasting it, but boy, this is something that is alarming. Sadly, no one in the media is probably going to cover this. Phil Williams won't do a story on this kind of stuff, but want to thank y'all. Even addressing childcare, which is a workforce development issue, every one of us should be working together. This isn't a Democrat issue or a Republican issue. Also got Chairman, if I could, I've got a question from a constituent. So the last couple of years, Tennessee has been a part of the summer EBT program, which has given the state $78 million in summer food benefits for the summer months when school isn't in. They're not going to be a part of that program anymore. Can y'all address this constituent's text?
Yes, sir. Thank you so much for the question. So summer EBT just started last year. There was a pandemic EBT that was created and then existed every year. And then President Biden made a formal program called Summer EBT. So that benefit provides $120 on a card for a variety of eligibility standards. Governor Lee, when we opted in for 1 year only because we wanted to look at what existing programs already existed in Tennessee. Could we grow that participation and make sure that we were using Tennessee tax dollars, whether they were state or federal, as judiciously as possible? So in this year's administration amendment, you'll see an investment for $3 million of state dollars for the governor's investment in summer meals. So what we did is we looked at our summer food program, which last year we served over 3 million meals in that, and we looked at Seamless Summer. We looked at the counties that didn't have a summer food program or were underserved by their summer food program. And then with our new technology, we were able to look and see how many households in that county that were unserved or underserved, and then how many kids were in that household that were between 5 and 18. And then this summer, we will be able to load $120 on that card for those kids that are not served by the summer food program. We're really appreciative of the governor's investment in this, and we think that this is a good way to make sure that no kid goes hungry in Tennessee.
Yeah. Thank you. Thank you, Commissioner.
All right, thank you. Next on the list, Representative Love, you're recognized.
Could, before I ask my question, recognize that there are some gentlemen here from the Kappa Alpha Psi Fraternity Incorporated. If they would please stand, let's make them welcome. There's also an abundance of men wearing different colors. They're wearing purple, like I'm wearing. They're from the Omega Psi Phi Fraternity, but they're upstairs, so you'll see them in the hallways. They're up in the meeting right now, Representative Parkinson. All right, to the question I have, childcare importance cannot be emphasized enough. We hear many conversations about it and the childcare deserts that we have. Having operated one myself for a number of years, I know the importance of financial stability, particularly for those who try to offer childcare at a reasonable rate on a sliding scale for parents to be able to afford without paying the equivalent of college tuition. And this is more of a statement than a question. I would just simply ask that you would continue to be open to proposals that would provide more financial stability. It's nothing like coming to the end of the year if you're on the voucher program and having, as the end of the year closes, you having to wait for that repayment and reimbursement. It's nothing like having a child who misses 2 days and you want to hold the slot for that child, but the state does not really pay for the slot. And you having to essentially make it over to the next reimbursement period. So I know you've worked tremendously hard on it. We've had proposals and bills, but my ask is just simply just stay open to those considerations.
Thank you for saying that. And I just wanted to give a quick response. We hear you on that one. With our new C-Care that just rolled out, it's a technology platform. We provide weekly payments to providers now. So thank you for that feedback.
Okay. Thank you. Thank you, Chairman.
All right. Thank you. Representative Parkinson, you're recognized for personal privilege, sir.
Yeah, thank you, Mr. Chair. Chairman Baum's been distracting me the whole time I've been over here. I'm just giving you a hard time. Mr. Chair, I did want to recognize one of these young gentlemen in red jackets. Mr. Alfred de Graffenried, I used to coach him in football. And so that is why, stand up, there you go. And I'll let him tell you how hard I was. I was fresh out of the Marine Corps too, coaching him. So, but I love to see him and he's made an incredible individual out of himself. So I truly appreciate you, man. Glad I was part of it. Your success. Thank you.
All right, thank you. All right, members, I have no one else on the list. Department, you all stood in fine. So thank you. Y'all did a great job. So that does conclude our presentations this morning. So without objection, we will go back into session. We're back in session, and that does complete our calendar for today. So just a reminder, budget hearings will resume on Monday, March 10th, 2025 at 8 a.m. and it will be in House Hearing Room 1. That's 8 a.m. for some of y'all that may have missed that. Do we have anything else coming before the committee? Hearing none and seeing none, without objection, we do stand adjourned. We are adjourned.